It's a cafe conversation in the ladies' room. 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 A cafe conversation in the ladies' room.
Good evening, good evening, good evening, and welcome to Cafe Conversations in the Ladies' Room. I'm your host, Sharice Sanders. Thank you for joining us tonight in the cafe. And we are in beautiful Stroudsburg, Pennsylvania today, where it's raining. Where it's raining. I'm just saying, the one day we have 55-degree weather, all of a sudden now we got rain, and I tell you, I just don't understand. When it's nice and sunny, we get a blizzard. And then the one day it's 55 and I want to put on a skirt. Now oh, it's going to rain tonight and everything. So, but let's be grateful for no blizzards, right?
Yes, I
And
was
no
about to
snow.
say I'll take the rain any day compared to snow. I'm
No
just saying.
snow. Absolutely. Well, I am so happy to be in the cafe tonight with new friends, old friends, and we have great conversation for you tonight. We have a conversation that's really important because it affects all of us. It doesn't matter what neighborhood you live in, what area you live in, but it affects some of us more than others. So tonight we're going to talk a little bit about our health, and disparities in health care in low income neighborhoods and stuff. And are you really getting the health care that you deserve? We'll talk a little bit about why it is that many of those areas might continue to, run that hamster wheel because of certain elements or situations that might be happening in those areas. And then we'll talk about resources and how we might be able to strategize against getting out of that and being able to do more for our community so people are healthier and happier and live longer lives. So, prior to getting started, I just want to share this with you. The views, opinions, and statements expressed by the host of Cafe Conversations with the Ladies Room and any and all guests are solely their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. And the views, opinions, statements, and or beliefs disclosed are not necessarily representative of Roots Living Ministry and or any of its affiliates or subsidiaries. So, tonight in the cafe, I'm so happy to introduce a couple of people. Yay! First and foremost, like I said, hi, I'm Sharice, your host for Cafe Conversations. With us, we also have Miss Zakia Morrison. She's an RN. She has, oh my gosh, when you guys hear her story, it's gonna make you cry because I tell you, I was heartfelt and had to sit in my car for, we must have spoken for about what, almost an hour and a half about her story. And it's so encouraging and so empowering that the fact that she's here today to share it with us, I'm very grateful and I'm thankful for you. So, hey, Zakia, good to see you.
Hi, everybody. Thank you for having me. And honestly, I still cry to this day if something triggers me, but
I
we'll
can
get there.
imagine. Hey, I understand because not many of us could have survived what you went through,
Yeah.
so I'm looking forward to you sharing your story, with our audience tonight. And we also have in the cafe tonight with us, representing on behalf of the senior citizen community, yes, Miss Sandra Morales, retired district sales manager. Welcome, Sandra.
Thank you. Thank you.
Yeah, this is your first visit to the cafe, right?
Yes.
Yes.
Yes,
Yes.
I'm so here.
Thank you.
I love the fact that, you're coming to, advocate on behalf of a community that I can't speak for. I'm not a senior citizen, but, to have you here, to tell your side of the story, what you go through and what they're going through. And people need to hear what you have to say. So thank you so much for joining us in the cafe tonight.
Thank you.
And with us also is Miss Kimberly Anderson, Equity Manager for Healthcare. Hey, Kimberly.
Hi, darling. How are you? It's a pleasure tonight to be with all you beautiful queens and all this family that we're going to be having great conversation today. So I'm definitely excited.
Well, Metamorphosis is all about making changes. We like to shake things up a little
all
bit.
the time. All the
There
time.
you go. The only way to fix it is to charge it head on, attack it head on, and say, hey, now what do we have to do to make it better?
That's right.
Yes. And finally, last but definitely not least, an old friend, Karen King, RN. Hey, Karen.
Hi, ladies. Thank you guys so much for having me. It's always a pleasure.
Thank you for joining us, even in your travels, girl. We're glad that you were able to, come into the conversation. I'm very excited to have you, in with us also. With most of us being in the medical profession, I'm sure we all have seen our share of situations with our patients, and clients where, you just kind of had to sit back and say, it shouldn't be like this. It shouldn't happen like this. It shouldn't, we should be able to do more for them than what we're doing, and tonight, I think for us to have a conversation about what's happening and how we might be able to change that. What can we do strategizing together in the community to try to make the changes to make sure that our elderly, are taken care of, our children are taken care of, we as women are taken care of, and that we're getting what we need. Excuse me, we're getting what we need health wise so that we can be here to have, successful communities and families and education systems and so on and so forth. So we're going to get started with this conversation because I, like I said, I really can't wait. But I want to give a little background information for those who don't understand what it means, what the term health disparities may mean. So the term health disparities is often defined as a difference in which disadvantaged social groups, such as the poor, racial ethnic minorities, women, and other groups who have persistently experienced social disadvantage or discrimination, systematically experience worse health or greater health risks than more advantaged social groups. When the term is applied to certain ethnic and racial social groups, it describes the increased presence and severity of certain diseases, poorer health outcomes, and greater difficulty in obtaining health care services for these races and ethnicities. When, when systemic barriers to good health are avoidable, yet still remain, they are often referred to as health inequities. So, that being said, I want to open up the discussion with why this might be happening in our communities, and in doing my research, there were a couple of things that came up that I was a little perturbed, when I read it, only simply because even though I know it's true, there are situations that can be they can actually be addressed and alleviated, but they're not. And so it continues to perpetuate this wheel of unhealthy conditions for these communities. And some of that is the cost of healthcare and medication,
Yes.
and the fact that medication is so expensive and healthcare is so expensive and the doctor's visits and the co-pays, and this really does throw a monkey wrench and those that might be um might be on a fixed income or low income, a family in the Alice community, which are the working poor, this will throw a monkey wrench into them getting the quality health care that they need because they can't afford it. I'd like to start with our representative Sandra, for the senior community, because you all have a unique story. And I'd like for you to give us a little bit of an insight, Sandra, on what you've experienced in trying to get good health care in your community.
Well, let me tell you, I think I have to click myself so you can see me, right? Is
We
that
can
what I-
see
We can
you.
see you.
Oh, you can see me. Okay. First of all, I'm a single parent, and I'm grateful every single day that I have two wonderful children. This particular last year of 2021, I took two falls, and I was
Wow.
all alone. Had to find my way, didn't have my cell phone next to me, and had to
Mhm.
find my way to the door so that I
Wow.
can get myself out. Blessed be that I had a friend come by on my first fall and was able to get to one of my bedrooms. I have two bedrooms downstairs, and I'm
Mhm.
upstairs at one bedroom, but I was downstairs at the time. And what ended up happening is that he thought that something was wrong and I had to get to the window. I unfortunately have had surgery in 2008 and 2010 for knee replacements that today do not allow me to bend the knees. If I'm on the floor, I cannot get back up. So that is my greatest fear. I experienced the first one. He was able to come through the house and get me out. The second one, I had to literally scrub myself from where I was to the door to open the door in a nightgown. And blessed be, I have two great children that came quickly. I didn't go to the doctors the first time because honestly, I just felt I took a fall and that's okay. It's just a bruise. But the second time I realized that I was in trouble and I had to go to surgery. I went to see my orthopedic, and from there we went to surgery. Speaking about healthcare, I currently pay over $400 a month for healthcare
Jeez.
because of the fact it's over $434 a month, because of the fact that I have an income. Blessed be, I made good decisions at an early age, and I didn't qualify. I've never qualified for Medicaid. I have Medicare, and that's an out-of-pocket expense. But I also have Blue Shield to cover that 20%, and I have Humira to cover the prescription. I have 4 prescriptions: one for the teeth, one for the 20%, the other one for Blue Shield and Blue Cross for that 20% that needs to be paid. My prescriptions is from Humira, and unfortunately for me, I have to meet $400 in expenses before I get the deductible. So I had a situation not too long ago where I needed emergency medication and had no choice and had to pay $100 for that medication for 1 week.
And you're on a fixed income.
I have
Is
a-
that correct?
But I just don't have Medicare. I'm sorry, I just don't have Social Security. I have a second income because,
Gotcha.
like I said, I made good provisions for myself early
Right.
on when I was working. But if I didn't have that, I probably wouldn't qualify for too much. And yet I'm a homeowner, a Hispanic homeowner,
Yeah.
and I live by myself. My children do not live with me currently. And one
Mhm.
of the challenges that I find, and I have a lot of senior friends who are going through this, is that you're right when you say, we don't have access to affordable healthcare services because not all of us do qualify. And I'm one of them that I don't qualify for a lot of things. People get Medicaid, I don't qualify for Medicaid. So that's where I need to maintain good medical coverage so that I don't have to do this. I don't have to, continue to battle. This year, I discovered that they have, because I do try to research, the Medical Advantage Plan. And the Medical Advantage Plan means that, yes, I will qualify, but every time I see a doctor, I do have to pay. So here comes the out-of-pocket that I'm not paying for. But I think
Right.
for me personally, it would probably be a better option than to continue to have to put this out-of-pocket expenses of $434 a month.
That's a lot. That's
That's
a
a
lot.
lot of money.
And that's
because
just you.
I don't
And
see the doctor every day or every month, you know?
right,
So
exactly.
it's a lot of money. But the cost of medication is outrageous. I
Yeah.
also have a condition where I have asthma. And for me to be able to get my asthma pump, I can pay as much as $75 up to $58.
Yeah.
And again, if I don't meet the deductibles, I pay full price. If my
Yeah.
prescriptions are not where they need to be, I don't even get that discount. And people talk about the cards that are being offered to senior citizens. Unfortunately for me, none of them have worked.
Wow.
So there's got to be some better answers as we move
Wow.
forward.
I I I I'm with you 100%, and it's sad because it's you work your whole life paying into social security and paying into, insurance and paying into medical bills and taxes and all like that. And then when you absolutely need these services, you can barely afford to get what you need, you know? And it's no fault of your own. You're
Right.
doing what the system sets up for you to
Exactly.
follow, but it's sort of like, okay, I follow the system, but I still can't get what I need, so I go to work to try to make more money so I could get what I need, but now I don't qualify for what I need,
Exactly.
because I'm making more money. And no matter what you do, you kind of hitting a brick wall, you know. Zakia, I kind of I would love for you to share your story at this point, and I want you to share your story because your story was on a magnitude that most of us would probably just sit back and be like, I don't know what I would do, at that point. But I'm gonna let her tell you what she experienced and what she went through, and then I have a question for you once you're done.
Okay. So my daughter is 5 now. Thank God. Can you guys hear me okay?
Yes.
Okay.
Yes.
So I was 36 at the time. It was my first pregnancy. Thank you, God. I was able to get pregnant finally, and I was cruising along. I was working full time as a school nurse at a special needs school. So these are a lot of kids that have they're in the wheelchair. They require a lot of lifting. But I had support. I had an assistant who would help me and do all the heavy lifting for me. I started noticing when I turned 5. Now I never had morning sickness or anything. I would have never known I was pregnant if I wasn't getting the belly and positive lab test, right? So when I was approaching the 5-month mark, I started feeling really tired. Like I can get out my car, and as I was walking to go up the steps to go into the school, I would stop and catch my breath. Then I would notice from getting to the building down to the nurse's office, I'm out of breath again. I'm like, wow. Then I started having the heartburn that would never go away unless I stopped what I was doing. So if I was in the middle of running around in the nurse's office, I would say, let me sit down for a second and catch my breath. Then the heartburn, which was now considered chest pain, would stop. I was vomiting. I just wasn't comfortable. So I called my OB, and I let him know what's going on. And I'm getting all these over-the-counter meds. Nothing's working. So I take myself to the ER. The ER, they do my vital signs, they draw my labs, they did an EKG. Everything's normal. Now, CPK and troponin are heart enzymes that should never show up in your lab work. If they show up, we have a problem. It means your heart is stressed out.
That's correct.
It was negative. Nothing was showing up. Everything was normal. And I kind of peeked the results myself, like, oh, okay, maybe I am just doing too much. So I went home. I let OB know that I took myself to the ER, and they said I was just, take it easy at work. But I was letting them know, like, I'm still having this issue. Nothing's helping. I'm not overexerting myself at work. I'm only 5 months. Everybody keeps telling me I'm doing too much. I should not be this out of breath at 5 months. There's no way. And then I would think to myself, like, how are people making it through these pregnancies? I can't make it through one. Like, all that was going through my head. So left the ER a couple of days later. I'm on the phone. I'm like, these over-the-counter meds aren't working. What else can I do? It got to the point where I could not go up steps. And one day, I made it make maybe another week and a half. Excuse me. And I came in the house and I just started crying because I couldn't go up the steps. That's how out of breath I was. And it made me cry before I even attempted, because I knew what it was going to hit for. I was going to have chest pain, heartburn, out of breath, vomiting, need to sit down. Nothing would help. I go back to the ER this time. we do the same exact thing. I say, why, they say, why are you here? Oh, I have heartburn. I'm tired. I'm 5 months pregnant. So they take me in the triage. They do my EKG. They do my labs. Labs are through the roof with troponin and a CPK lab enzyme. So I'm like, oh my gosh. They do the EKG. They didn't tell me at the time. She walks out the room. She said, I'll be right back. She walks out the room. I'm sitting there eating an apple because she did my blood pressure. That looked fine. I'm sitting there munching on an apple. And I just remember everybody started coming into the triage room and staring at me. And they're like, oh, we need you to sit in this wheelchair. So I'm like, okay, we're going to a room. So they say, yeah. They're like, who do you want us to call? So now I'm like, oh, something happened. So I said to, I guess they wanted the doctor to come talk to me. I said to the nurse, call my mom. It's the first thing you say, like, call my mom.
All the time.
Mind you, I was in the middle of selling a house. So Zaya's dad was like, not even far, but I just wanted my mom. I didn't even want to call him and say, get to the hospital. I'm like, call my mom. So she shows up. The doctors come in and they said, you have to go to the operating room. You had a heart attack. And I'm like, what? Like it kind of had the process, but I swear it should have been an episode on TV because my mom automatically said, she just has good insurance and you guys are trying to get her insurance money. We're just here for antibiotics. It's probably just a bad cold. My mom went way left. Like she couldn't process it either. And when I started crying, they said, swallow this. And it was aspirin. And all I could think about was every commercial you see, if you think you're having a heart attack, take baby aspirin. And they were like, we need you to take this aspirin. And I started bawling. And then by then my sisters are showing up and they're like, it's okay. It's okay. Like, calm down. But I'm like, they said I had a heart attack. They didn't know what to do because I'm 5 months pregnant. They can't rush me to the OR and give me all types of meds. They call OB to come and make sure the baby had a heartbeat because now we don't know if the baby's alive because they don't know exactly when I had the heart attack because I've been complaining every day. So how long has my baby gone without oxygen? And they don't know if the baby's gonna, survive the OR. So now they're calling all the attendings they could think of at home. Like, what do we do? They started calling around the country because nobody knows what to do with the pregnant girl. So they agreed to, they came up with a plan. They took me in the OR to place a stent. They really couldn't give me any meds. And at that point, I was like, do what you gotta do to save my baby. If I gotta be awake and alive, I'm alive. I have to be awake and put up with the pain for you to get this operation done to save my baby. I'm all for it. So they ended up placing a stent. And it's like little things you remember. I remember saying I had medication. They kept trying to make me swallow a pill. And I was like, it's sitting in my throat. So the whole time we're in the OR, I'm like, can I eat? Can I eat? And they're putting the stent and it's going through the arm and I'm watching it up on a big screen with them and they're trying to keep me calm. And so we made it through that part. And when I remember coming out of the recovery room and my family expected me to be, in a stretcher with tubes all over me, but it really wasn't like that. Like I came out and I was like, I'm okay. I just need to get to recovery. I'm really tired. And you know what I remember? I don't remember her name. I don't remember her face. I just remember her coming in the room and saying, you need to take care of yourself. And I thought to myself, my labs were perfect. That's why they never kept me in the ER or admitted me every time I came.
Right.
But you looked at me and because I was young, you made me feel like I was less than, and I put myself in this situation. To this day, they said they're going to have history books, medical books, and talk about me because they can't figure out what caused it. My cholesterol was fine. All my labs were normal. But for some reason, on that second visit, my heart enzymes were through the roof. So what triggered it, we don't know, but it happened. And you think about little things like that. Like I remember calling OB like every day, and it's 6 people that worked in the office, 6 OB doctors. They wanted me to meet everybody throughout the pregnancy, just in case I don't have the person who I want to deliver my baby, who I was going to be dealing with for the whole pregnancy. And I remember one time, one of the doctors, I was saying, I'm really feeling tired. Do you mind if I take a day off from work? And she's like, oh, I'll just write you a doctor's note saying not to lift over 10 pounds. And I remember saying, that's not the issue. I asked you, can I have a doctor's note? Because I'm really exhausted because I'm having a lot of heartburn and chest pain. But, little things play in your mind. And I'm like, she really dismissed me and thought, was I being lazy? So little things you think back, and best believe I called guest services and everybody else who I thought back about, because I don't want that to happen to the next pregnant woman. So I did report people who I thought made unprofessional comments toward me. But it's funny. Let me see if I can show you guys a picture. Because when I say I did not have the symptoms of what you see on TV, let me see if I can zoom in. The week.
Oh, look at her. No, you didn't.
That's the week I had the heart attack. So I don't look like somebody that's in the middle of having a heart attack, right? So it's
Right.
little things like that where I just felt like I was kind of prejudged. And so what else? I made it through the pregnancy, and I was everybody's best friend after that because I then had a cardiology team, and she was good. She likes working with pregnant women. So when I say, she would text me every week and just say, how are you doing? Or, let's check, stay on top of these labs and your blood pressure. And I made it through the pregnancy, and she came out perfectly healthy. But there's a part two to this story, because I always told them, even though you guys placed this stent in my heart, I still feel like I'm getting out of breath when I go to run up steps, or I'm an adrenaline person, so I like getting on roller coasters and stuff at the amusement park. Anything that would make me overexert, I still feel like I was really tired. But they did a stress test, on a treadmill, and everything was fine. Labs are normal, okay? The EKG will never be normal because it showed I had a heart attack, and for the rest of the time being, it will always show that I had a heart attack. So, but everything else was always normal. My doctor said, since we can't find anything wrong, the next time you have this pain, I just need you to bring yourself to the ER so we can try to run some tests. That's what I did. I was having some pain at home one night. Now my daughter's going to be 3 at this time. I go to the ER. What's showing up again? CPK and troponin in my lab work. They're like, oh, your heart is stressed out. We can't let you go home. We got to figure out what's going on. And I remember my cardiologist came in the morning because her shift started at 6 a.m. And she said, why didn't you text me? I remember I started crying because me and her were pregnant at the same time. And I was like, you're always here. I just want you to have some time with your baby. And I knew that they would tell you I was in the ER anyway when you got here. So she was like, we're not going to play this time. We're going to go straight up to the OR and take a look and see what's going on. Well, when you have a stent placed, it's supposed to have medication around the stent to keep it from closing up. Because I was pregnant, I had a stent placed with no medication. So what happened? It was closed up. And I said, so how am I alive right now? If it's the widowmaker, the left anterior descending artery, which carries all the blood to the bottom half of your body.
That's correct.
How am I alive right now? My heart grew extra little tiny arterioles around the damaged area. So the part of my heart that was blocked, I had little arteries go around it. So that's how I was able to function. Those little tiny arteries took care of the area that was damaged. But because they were so tiny, whenever I did things to overexert myself, I found myself taking a break and sitting back. So off to the OR we go again. But this time we can do the latest technology, I'll say. So his name was Dr. Sutter, Francis Sutter. He's going to be retiring this year too. But I was lucky because he's done the most robotic surgeries in the country. So, he came and he checked me out to make sure I was a good candidate. And he decided I was. And it was Halloween time. And he was like, go home, be with your family, come back on Monday. And my mom and my family said, well, how's she going to go home if, she's got this blocked artery? She's in the middle of having a heart attack again. And he said, I'll never forget. People say the darndest things. He's like, well, she's already at the bottom. You can't go anywhere but up from here. And I kind of laughed it off. And I just was like, you got to take doctors' personalities for, I don't know. He thought he was making a joke, but I just was like, oh, okay. It kind of threw me for a loop that he said that. But when I say after that surgery, they had the robot go, and it's equivalent to being shot in your chest 3 times. It punctures 3 holes through my breast to get to the area of the heart where it has to work on. So I remember waking up from the surgery. I was in like tons of pain. I couldn't breathe because it was, he said he had a hard time getting through my breast to the area of the heart, but he did. And I feel $1,000,000 better. And I say, okay, now I feel like how I used to feel before I got pregnant. Like, I feel like I can breathe now. I could go up steps and I could walk and walk and walk. But I do have that fear of, is this heartburn because I ate something spicy, or, am I about to have another heart attack?
Situation? Yeah. I thank you so much, Zakia, for sharing your story. And the reason I wanted you to share that is because there were several components of your story that is so relevant to what we're talking about tonight. First and foremost, you being a African American woman, okay, and one of the things that I found in my research was that African American women, we tend to get ignored at times. Our concerns and our feelings get blown off, or you're just overthinking it. It's not what you think. You'll be fine. Go home. Go home. Just get some rest and see me in 6 weeks. In my case, the cardiologist, I went to the cardiologist with shortness of breath, chest pain, and he told me to come back in 5 years.
Oh my God.
You know, and I'm like, in 5 years, I'll be dead. You know what I'm saying? So, but the thing is, what I liked about your story, Zakia, was the fact that you were very proactive in your care. You know, you didn't give up when they kept going, oh, you're good, your labs are normal, everything's okay. You know, you kind of kept pressing the bar and going, nah,
I
something's
don't know
not
if it
right.
was like
Something's not
woman's
right.
intuition, because I just was like,
Tina,
something's not right. I
Yeah.
can't prove it.
a
But
woman,
something's not right.
a woman knows her body. I am a perfect
Yes,
example
I
of that. I know my
so
body,
agree.
and I
Yeah.
definitely know when there's something wrong and you're just not on your A game. When I was 30, I also had heartburn, and I kept saying, "Oh my God, like I just can't seem to get this out of me." And I was in Florida, and I'll just never forget it. I was laying down and I just couldn't breathe. And then all of a sudden I had like a tank top and my heart was coming through my skin.
Oh, wow.
And I panicked. I was like, oh my God. So I called my aunt. We rushed over to the hospital. My heart was just felt like it was about to explode. They can actually see the heart beating through my skin. And I was like, oh my God, you know, they're like, calm down, you know, gave me all these tests and stuff like that. I spent the night, okay? They brought my heart rate down and stuff like that. And I want you to know, is this day, and they never told me I had a heart attack. Because let me tell you that Florida insurance and Florida hospitals are the worst. Are the worst. I went to see cardiologists, everything to find out what happened to me that day. And they were like, you can go home after 7 days. You just had a heart attack. I'm sorry, what? Yeah. And they never followed up with me ever. So I get that part. See, I totally get it, but it's up to us to definitely take that initiative to find out exactly what is going on.
Absolutely. And that's the part that, you know, I think is going to be so important about our conversation this evening, is us talking about being proactive in our
Absolutely.
healthcare, so that we are not subject to, you know, these disparities, but also, you know, talking about why, you know, these disparities are so prevalent in our communities, you know, because we can't put it all off on the doctors. It
Right.
is on the patient also. You know, it's a mutual relationship. Karen, I'd like to backtrack to you. I know you had something to say just now. I'm sorry. Oh, okay. All right. So some of the things that I wanted to, you know, just kind of bring up that I found in my research, that they were saying, you know, causes such um a disconnect in healthcare from, you know, Black and brown communities, low income communities, people in poverty and things like that, were like, you know, one, ignorance and lack of understanding in the true sense of the word, you know. And I'm not talking about, you know, people just, I'm talking about people just not knowing,
And
you
you know
know,
what
that.
I find with the
Mhm.
young ones, if they realize they don't like a doctor, they just don't go back. But we don't never have a
Right.
backup plan. We gonna figure it out some
You just
other
don't
way.
go.
They let it go.
Right. You
And a
know,
lot of
and
things, with the seniors happens that the doctors, excuse me for jumping in, that
no
the
problem.
doctors speak to us with their terminology. They don't speak to us with our understanding. For example, when I had my knee surgeries, my 2 knee replacements, I had them at different times. I've been complaining for years that I can't bend those knees, and they keep arguing with me, to come to find out years later that I had knee replacements for a person 85 years old. Excuse me. I'm not even 85 yet. I'm still 69.
Right.
And that in 15 years, I would have to have them replaced anyway.
Wow.
So you
Wow.
think I trust someone to go back into my knees again after what I've been through? So
And
I feel that it's the communication between the medical providers the doctor
Mhm.
and us.
Mhm.
You know, I happen to have a very good primary where we
Mhm.
talk,
Mhm.
you know, when he starts to talk that language, I say, I don't understand nothing you're saying. Give it to me straight. This is
Right.
what you're
Layman's
going through,
terms.
Sandra. This is what you need to do. I have high blood pressure today. You know, I do take medication for high blood pressure. He
Mhm.
monitors. I also have RA because I had blood clots in the past. So I am on, you know, warfarin medication, which is Coumadin, and he monitors that. We speak very clearly, but as soon as I go to another doctor, I'm lost.
And I think that's part of the problem with, you know, the healthcare system. There should be checks and balances in place, you
Exactly.
know, to make it easy for patients to be able to get what they need. You know, I mean, what about people who speak a second language outside of English?
Yeah.
You know, I
Spanish,
mean,
the Hispanic
there's
market.
supposed to be someone who's there to be able to translate for you so that you can understand. But having a lack of those services, you
Correct.
know, now you have someone sitting there trying to make a decision about what's best for them health wise, but not fully understanding what's being told to them. You know,
Exactly.
not to mention the frustration that the physician might feel trying to explain and also trying to stay on a time frame. You know,
Correct.
because in most cases, when you do go see the doctor, you're only in that room with that doctor for 15 minutes.
That's correct.
You know, so if within that 15 minutes you have not been able to say, this is wrong, this is wrong, this is wrong, and the truth of the matter is, if you go over three, you know, now they're going, well, what is your biggest problem right now?
What are
Right.
you concerned with? What
You
is your biggest
understand what I'm
concern?
saying? Yeah, what is your biggest
What is your
concern?
biggest
So
concern?
a lot of the times, you know, it all might be connected, but we're only talking about one thing. And then when we're talking about that one thing, everything else kind of gets pushed down the line for another 6 weeks,
That's correct.
you know. And
Correct.
then a lot of times your critical conditions don't get to be addressed until it's too late,
That's correct. That's
when
correct.
they could have been avoided, you know. So a lot of that is, we have to be able to go, you know, when we go on to the doctor, and if we need those services, you know, people need to be able to say, listen, I need you, okay, to get me an interpreter before the appointment, you know, so that when I come to the appointment, one, I'm not sitting there for 30 minutes waiting for somebody to come. And two, you and I can have a understanding of what it is I need and what it is you feel you want to suggest to me, you know, so that I can really get the health care that I need so I can be better.
And
A lot of
have
times.
paper. Oh, go ahead. Sorry.
No, go ahead. Go ahead. Go ahead. Go.
And I was gonna say you gotta have the paper and pen, because then I go check.
There you
Because
go.
like you said, don't focus on one and be like, okay, see you in a couple months. You'd be like, wait a minute. So once I do my little check mark, they know I'm not playing. Like, okay, what's my next issue? You gonna answer my little checklist real quick.
Yeah,
That's how you
absolutely.
have to be in healthcare. That's, as you know, when you're representing yourself, you know, as a
Yes.
minority, you have to come with your checklist. Like I tell my parents
Mhm.
all the time, write it down. When is your next appointment? If they tell me, oh, you know, my knee is hurting, you know, like I'm feeling this, I'm feeling that, write it down on a piece of paper. When you go to your doctor, you make sure you go with your list and you address everything. Do not walk out of there unless they address everything for you, because sometimes they may not realize that everything is connected. And then sometimes it's
Absolutely.
like, not for nothing, you get ignored. You get ignored when you voice
Absolutely.
something. And, you know, like I'm touching on the fact of when she's addressing the fact of, you know, she's saying, hey, you know, like I'm walking up these stairs and, you know, I'm out of breath. You know, I'm
Mhm.
complaining that, you know, I'm having heartburn, and they're ignoring her signs, you know?
Literally.
And not for nothing, when I was pregnant, after I delivered my baby, I told him I'm going to die today, you know? So I know what it feels like when you as a person, as a human being, tell someone, this is my body. I know what it feels like. I know what I feel like. I know how I'm feeling in this moment, and I need you to pay attention. And they
Right.
look at you as if you don't know anything, and because I have a degree, I know everything. And literally, when I'm laying in the recovery room and my doctor pulls the curtain as I'm passing out, the last words I hear him say is, she said she was going to die today, and by golly, she's going to die.
Oh my God.
Wow.
So it's
Oh
like,
my
you
God.
know,
My God.
and from that moment on, whenever I called him and I said, hey, I'm feeling this or I'm feeling that, he took me, like, they take me seriously. And I have found things within myself that a sonogram didn't find. Like one day I said, gosh, like I'm feeling this little twinge. And I called my doctor and I said, hey, I'm kind of feeling a little funny. Like, and I can't explain it, but I feel funny. So he said, oh, you're always getting cysts on your ovaries. I'm going to send you for a sonogram. And I said, okay, no problem. Send me for a sonogram. I know that's probably what you're going to say it is, but it feels a little different. So he said, okay, no problem. And I go, and I had what is called a clot in the guinal vein. It is one of those textbook, like literally, and the same thing. Oh, 1 second, give me a moment. This person comes in, that person comes in, and now
Yeah.
you have everyone in the room, and now you're being quartered off to the emergency room. And it's like, when no one listens to you, this is how people die. This is how people
Yes.
of color, brown and
Yes.
black people, this is how we die, because
correct.
no one listens, So
Absolutely.
this is how our disparities become worse, because no one listens. No one is listening to the fact of, oh, if we fix this or we fix that, then hey, guess what? Things can change for this person.
Mm-hmm.
So
I agree with you 100%. And the sad part about that is you can complain and complain and complain, and the complaint goes no further than, patient care and stuff. It goes as far as, your patient services representative. And then, but the thing is, your complaint goes unnoticed, but let you not pay that bill, and they're calling you, on some, hey, you still owe us $1,200 for coming in to see Dr. So and so. And despite the fact that you feel you didn't get the care that you needed, he still needs to be paid because he worked for 15 minutes at that moment.
yep,
You
and
know?
dare appeal it. Yes.
Okay. And I've been through that, just recently, just went through that, just going back and forth to the emergency room, back and forth into the emergency room. Okay, telling them I'm having shortness of breath, I'm having pain in my chest, and it was kind of like, okay, well, we're not seeing anything, we're not doing anything. Then I got there, and a third time, okay, on the orders of the doctor this time, and got there the third time, and it was kind of like, had to get into excuse me, a tit for tat with the nurse, because I'm not understanding why it is that when I walk into a emergency room, because I walk into a room with another person of color, they feel they need to address me in a certain manner, and certain things can be done and I should overlook it, and it's kind of like, being a nurse myself, there are certain things I would never do. Okay. And one of those things is I would never drop something on the floor, knowing that the floor is contaminated. I would never drop something on the floor, pick it up, put it on the patient's bed, and then proceed to try to use that item, and it was kind of like, this is what she did. And when I said something about it, it was kind of like, well, the part that's going to go in your arm, okay, because she was trying to put in an IV, and she was like, the part that's going to go in your arm is inside the package, it didn't touch the package outside. I said, but the gloves you have on touched the package on the outside, that touched the floor, that you just put on my bed, and now everything around me is contaminated, and now you want to touch my arm with those same gloves. And the crazy part about it was, she actually got an attitude because I asked her to go get another kit to put in the IV and to change her gloves. We get treated as if constantly second-class citizens. just
Right.
as women of color, you know, depending on where we live or where you live, you know, and and it happens in many communities. It's not just, you know, black and brown communities. It does happen in many low income communities, anywhere where you're running into, you know, people who are in poverty, people who, you know, are dependent on the government insurance, you know, people who you might have high incidences of welfare, or you know, the home conditions are not, you know, A1 or something of that sort. You'll find that the treatment and the care tends to slack a little bit, because it's sort of like them saying to you, you're not as important as the person that has money,
That's correct.
you know.
Yes,
That's
That's
correct.
yes,
and it's a sad situation, because
it is.
whether I have the same amount of money is, as you
It's
know,
irrelevant.
right,
Yes,
it
it
doesn't
should be,
matter,
you
like
know, it should be irrelevant, but it's not, because not for nothing. I used to do traveling, and I went to
mm,
a nursing home one time, and a nurse came up to me and said, "Hey, you're going to be taking care of an important patient." And I said, "Excuse me, what did you just say?" She said, "You're going to be taking care of an important patient, and daughter, her daughter is the CEO of this facility." And I told her, I said, "Excuse me," I said, "I'm sorry. Everyone in this facility should be treated as if they're the daughter of the
exactly,
That's
CEO.
correct.
So
That's
at the end
exactly,
of the day, I will treat everyone the same way. And if anyone goes back and say that they were not the daughter of the CEO, then they're lying, because
yeah,
they're all getting the same treatment. I'm
yeah,
not gonna think, or I don't even want to know her name. I don't want to know who she is, because everyone is gonna get the same treatment. Because I'm not gonna go in there and
absolutely,
be like, "Oh my God, I have to treat you special." No, you are no special than the person that's next door to you, because you're
exactly,
suffering, she's suffering too.
I agree.
And I
absolutely,
don't think that just because you can afford to pay for your health care coverage, that she should get treated better just because she can't. No, it's not right. And they do it all the time. They
yeah,
do it all the time.
and
That health care
it's
coverage,
sad. Go ahead,
go ahead,
sorry.
go.
Yeah, no, I was just saying that it's sad that it comes down to money. You
It
know,
does.
it's
It
really
does. It
sad that it
does.
comes down
Because
to money and finances, and that, you know, your life excuse me, your life gets traded. There's a value put on it based on what kind of insurance you have, what
correct.
neighborhood you live in, the color of your skin, you know, your employment status, like all that stuff. The value of your life becomes, you know, based on that. And it's sad, but time is running a little bit short. So one of the things I do want to get to is, how can we, many of us work in the community, you know, and many of us are, you know, involved with a lot of people. We see this all over the place. You
Mhm.
know, what are some of the suggestions, some of the resources that you all know of, that maybe people in your community, and you know, I'm speaking for, you know, those who are senior citizens. I'm speaking for, you know, Zakia and moms with heart conditions. I'm talking to, you know, I'm talking about, you know, Karen, and, you know, those patients that, you know, are not getting the same kind of care as that CEO's mom and stuff. What can we say to those patients and clients to help them be more proactive in getting the kind of care that they need and that they want,
Well,
despite these circumstances?
okay. First of all, the nursing homes, are a big issue for senior citizens today.
Mm-hmm.
A very big issue. And I need to say that if you don't have Medicaid and Medicare, it's an out-of-pocket expense for you too. Okay. Then we have the home attendant, unqualified. For example, my mother passed away from Alzheimer's disease.
Mm-hmm.
Okay. And the one woman who took care of her, the home attendant who took care of her, her and I matched perfectly. I jumped in. She never knew when I was coming through because I never trusted anybody. She had a heart attack. And from that period on, I had 24 home attendants.
Wow.
okay, in that period of time. Why? Because they either fell asleep, they were watching TV, I
They were
walked in,
stealing.
my mother was soaked, you know, and different issues. So I kept changing them and changing them. My feeling is that we need to come back to something that we're not doing enough of, is the family support. And I understand that.
I
understand
agree.
it completely because
I agree.
I myself have experienced it. And I can tell you that the family is the most important part that plays in any of these care services. Because a lot of these senior citizens that are in the nursing homes and that are being taken care of by home attendant, there is no family present.
No.
So no
Wow.
one really knows what's going on behind the scenes.
The abuse,
Mhm.
Okay.
everything that happened.
And when you take on a family member, in my case, that I had my mom and she had Alzheimer's disease at the age of 58 and died at 66, I had to go to Puerto Rico and get her because they had put her in Puerto Rico on steroids, which now
Wow.
made her become even worse. When I took her home, I want you to know that at that time I had 4 brothers and sisters. I'm sorry, my family was a unit of 4. I'm number 5. I'm the youngest of 5 children. And no one wanted to take care of my mother. The suggestion was, let's put her in a nursing home. And I said, absolutely not. Absolutely not. That is not something we're going to do. I understand that it changes your life. I
Yeah.
understand that people feel that they're burdened. I
Yeah.
know it's a cost effect because you
Mhm.
have to make preparations for that senior citizen to be with you. And I've seen today where in personal issues, I've seen today where a lot of senior citizens have been mistreated by their own family
Absolutely.
members.
Absolutely.
And,
And
you know,
many of them
we need,
are suffering at the hand of, you know, people
family
just
member.
so that
Yes.
they can get their money, you know,
Yes,
so that they can
yes,
get the money too.
yes.
I've seen that also, you know,
absolutely.
so
And
that
for
they can
me,
get their money.
I know that, you know, we can do better with the nursing homes if we were
Yeah.
more involved as family members. We can probably do better with a home attendant if we were
Yeah.
more involved. But you can't put your own parent in the hands of other people.
Yeah.
That's where I feel the problem is coming from.
Understood.
And
So
a
I
lot of us, you know, wanting to take care of them because a lot of
yes.
family members do not want to take care of their elderly.
Yeah. So I definitely would say, you know, number one on the list is build a strong support system. You know,
Correct. Correct.
when you're going through things, whether you're going through it, you know, as a senior citizen or, you know, like Zakia, you know, and stuff, and her being pregnant and all that kind of stuff, you know, having a strong support system and somebody behind you. Also, too, to be able to advocate for you if you can't advocate for yourself. Because
Correct.
when you can't advocate for yourself, you know, then people who don't even know you are making decisions for you. But
That's
because
correct.
we're running short, I'd like to have Zakia. Zakia, if you could take 2 or 3 minutes just to give us, you know, a few suggestions of how we would be able, if we were in your situation, be able to get through that situation.
But you hit the nail on the head when you guys talk about family support. I was lucky I had that. But for those who don't have that, for young people, you know, we're really big with social media and the internet. I Googled support groups. I Googled women with heart disease. I got on Facebook, social media. I would ask questions because to me, that was the quickest way that I found answers too. Just kind of making a post on the internet and having all
Yeah.
these different resources and answers come back to me. I would call the back of my insurance card and try to talk to a case manager. Like, okay, this is what happened to me. Can I get some resources for blah, 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 what I need? So I basically think it all boils down to advocating for yourself. But I will say, guys, I just got
Absolutely.
approved for my nonprofit for that reason because I'm so
Yay.
excited, right? Because there are a lot of
Makes
women who, you know, they age out of foster care with nowhere to go, or you know, women who are just homeless. You don't know what the situation
Yes.
is. But I want my I want to start with just a 3-bedroom house and make it very family oriented because people
Mhm.
need support. So I want to help maternity women from pregnancy up until the child turns age 2 and help them build that strong family setting and be able to go to work or go to school or pick a trade. But I want them to have a secure home and support while they're going through whatever stage of life they're in to help get them, you know, moving and ready for their next step in life. So,
That's beautiful. And what's the name of your organization,
oh,
Zakia?
seed growth.
Okay. And how could someone reach out and contact you?
Should I give you well, seed growth, SEED growth,
Mhm.
GROWTH, Inc., INC, at gmail.com. It's the fastest
Okay.
way to get to me.
Okay.
But yeah, so right now I'm just searching for like a home location. And after that, I'm ready to hit the ground running because I have all my nurses and we're very excited. You know, we're going to be offering parenting classes, nutrition, therapy classes, Reiki. We're very excited about this.
Let me tell you, Sakita, that was something that I found. My daughter-in-law, being a new mom, the resources here in Monroe County was very limited. She actually had to go with like no Lamaze class, very scared. When you're a new mom, you need that. You need that support structure. I know when I gave birth to my daughter, I had that in the hospital. Like they was very proactive. Now, because I know that we're in COVID, I get that. But there are still women scared. They don't know what to do. They're in panic mode. There were no resources. And it's sad because, you know, I always say, you know, our era, we had it, we thought we didn't have it that good, but we kind of did compared to the era of today. So, you know, I'm glad that you guys are opening up because we definitely need some stuff like that.
Thank you.
Absolutely. Karen? Karen?
Yeah.
Hi. If you don't mind, would you take a few minutes and kind of give, you know, just some last comments of how, you know, patients can advocate for themselves?
I would say that if you know, when you want to advocate for yourself, make sure that when you are in your right sound mind, make sure that you fill out a healthcare proxy. Make sure that, you know, when they're offering you this, you make sure that you pick someone that is going to actually fulfill your wishes in a situation that you're unable to. It is so important. I realize that working in healthcare, like we do not do this as much as we should. We don't fill that out. And I think that's very important to have. And I would definitely do that. And I would also make sure that, like, as far as resources, there's so many resources available. There's pantries. If you're, you know, when it comes to food, there is also resources to help find jobs, to help you locate, you know, like job. There's also benefits as far as insurance, to help you pay for insurance. There's also for prescriptions. There's resource, like if you go to the pharmacy and you let them know, like, hey, you know, like I can't afford that. There's also, you know, like they can also let you know who you can call in order to help you with that. If your doctor prescribed you something that you can't afford, you can also, the name, like whatever prescription it is, you can contact them. Like, let's say your doctor prescribes Synthroid. You can contact them, the company. And because they want you to utilize their brand, they will actually send you a coupon. Yes. Your inhalers. You know, there's so many different resources, and a lot of people they really honestly don't know that it's available to them. If you type the name into the computer, you'll find that there's coupons available for these things. And sometimes the coupon is good for 6 months, sometimes it's good for a year.
Right.
And working in home care right now, I'm realizing that no, there is not a lot of support when it comes to the elderly. And unfortunately, sometimes as a human being, as a neighbor, check on your neighbors. You know that you have an elderly in the community, go check on them. If I haven't seen, you know, someone in my community in a long, yes, I'm gonna knock on your door and say hello and see if you're okay. Or if I'm walking and I see you driving, I'll stop you and say, hey, I haven't seen you in a while. Are you okay? You're good? And they'll say, yeah, you know, I had a cold. I haven't been coming out or something, you know, and they'll tell you that thanks for checking on me. You know, so check on them, because sometimes they really, honestly, they don't have anyone.
Correct.
Because they're outliving their children sometimes.
Yeah. This is true. This is true.
So,
You know, and one last thing I'd like to actually, you know, add in is get a second opinion. Just because one doctor said it doesn't make it law. You know, I mean, doctors are only people who are, yes, they've studied
They're
and they've
practicing.
done things over and over again, but they're still only human. They make mistakes, you know. Get a second opinion. Find out what someone else thinks. Go to another hospital, but weigh your options because at
Yeah,
times, one person's opinion is just their opinion. If you
yeah.
get 5 or 6 different people saying the same thing, then in that case, all right, maybe the majority is right.
Something's wrong.
But if you
And
only
you,
got one
Sharice,
person
you're so
saying,
right. You're so right. And you should tell them to also call the back of their card, their insurance cards, because
yes,
when you call the back of that insurance card, they will give you different doctors that
Expertise.
specialize with whatever issue that you're having, that you can get that
absolutely,
second opinion. And that will
absolutely,
be under your insurance that is covered 100%. That way you don't have to go outside of your plan.
exactly.
Correct.
Exactly. Well, ladies, we have to go. It's been, it's been
Amazing.
great
Amazing.
conversation. I think there's a lot of information that was given tonight that people can use to begin to get the health care that they need. And that's the whole purpose of this. We get together to have these conversations because we want people to know that, we have your back. We're in the community so that we can find the resources to give you the information so that you can be healthy, you can be happy, your children are healthy, and you're around to live a happy, healthy life. We got to say goodnight, but we will see you next week back in the cafe. Thank
Okay.
you, everyone who came tonight. Thank you to all my guests. We love y'all.
Thank you. We love you
Be
too.
safe, and we'll talk to
Have
you soon.